Is my child more susceptible to pink eye? When it comes to pink, also known as conjunctivitis, many parents wonder if their children are more likely to get it. The answer is yes, children are generally more susceptible to pink for several reasons. Pink eye is an inflammation of the conjunctiva, which is the thin, clear tissue covering the white part of the eye and the inside of the eyelids. It can be caused by bacterial or viral infections, allergies, or irritants. One reason children are more prone to pink is their frequent exposure to germs. Kids often spend time in daycare or school where they are in close contact with many other children. This close proximity makes it easier for viruses and bacteria to spread. Sharing toys, books, and other objects can also contribute to the transmission of infections. Another factor is that young children may not have the best hygiene habits. They might forget to wash their hands regularly or may touch their eyes without realizing it. This can transfer germs from surfaces or other people directly to their eyes. Additionally, children's immune systems are still developing, which means they may not fight off infections as effectively as adults. Living in crowded conditions, like classrooms or daycare centers, increases the risk of getting pink. Newborns are particularly vulnerable to a serious form of conjunctivitis caused by bacteria from the mother's birth canal. To prevent this, healthcare providers often apply antibiotic ointment to newborns' eyes shortly after birth. There are also common risk factors for pink in children. For instance, being around someone who has viral or bacterial conjunctivitis can increase the chances of getting it. Allergies to things like pollen or dust mites can lead to allergic conjunctivitis, which is not contagious. Contact with contaminated items, such as towels or eye cosmetics, can also pose a risk. For older children, using contact lenses can be a factor too. Symptoms of pink to watch for include redness or a pink tint in one or both eyes. There may be discharge that is watery, which is common in viral or allergic cases, or thick and colored, which usually indicates a bacterial infection. Children might complain that their eyes feel gritty, or they may experience eyelid swelling or sensitivity to light. Sometimes their eyes may stick together, especially in the morning, which is often seen in bacterial conjunctivitis. It's important to note that bacterial and viral pink eye are contagious. They can spread through direct contact with infected eye secretions or contaminated objects. On the other hand, allergic and irritant conjunctivitis are not contagious. If a child has contagious pink, practicing good hygiene is crucial. This includes frequent hand washing, avoiding touching their eyes, not sharing towels or pillows, and staying home from school or daycare until they feel better or as advised by a healthcare provider. If you notice any symptoms of pink eye, it is essential to seek medical advice. A healthcare professional can confirm the diagnosis and guide treatment. This helps prevent complications and reduces the risk of spreading the infection to others. In summary, children are more susceptible to pink eye mainly due to their frequent exposure to germs, less consistent hygiene practices, and developing immune systems. Being aware of the symptoms and practicing good hygiene can help manage and prevent pink eye in children.